Flinders and Upper North Local Health Network is a very beautiful area of the South Australian coastline. We have some amazing people, we have some amazing sites here and amazing opportunities.
This region is very welcoming. Gotten to know a lot of the staff across the two major hospitals in the region very well, and I find the work to be rewarding, like you feel like you're making a difference.
When they leave med school, this is their first official workplace. We want them to experience the full gamut of being responsible, but with supervision. So we're still there, but we let them actually experience what they need to do to become the doctors they need to be.
What I like as an intern is you rotate to different departments so you can gain knowledge and experience.
As an intern, it's more about learning and working the different systems, seeing what you're interested in, seeing what you might want to consider in the future.
Within the rotations that we have such variety in the presentations that we get. So just being on general medicine, we see all of the specialties in our one little team because we don't have subspecialties here.
Working regionally has allowed me to have some experiences that some of my colleagues otherwise wouldn't have if they're working metro. Growing up in Whyalla in a regional area gave me that passion to work rurally as well and to serve the community.
Continuity of care is one of my favourite things about working rurally. The people out here are really lovely, the community is really nice, and they're all things that were really important to me.
Because it's such a small hospital, you learn everyone's name, you learn the names of the doctors that come in.
I think it's a lot more hands-on, so having that opportunity is really awesome, and everyone here really pushes for you to do that as well, which is really helpful.
Spent my internship in Flinders Upper North, as well as my emergency term, which was in Port Augusta, which was 3 days a week in the Port Augusta ED, and then 1 day a week with the Royal Flying Doctor Service.
When I first moved here, I was nervous. 2 or 3 weeks into the training, I started to feel at home, and I started enjoying the work, the people around me.
Some of the best things about living in a small town is the community. You work with quite a small group of people compared to what you might in the city, and you really get to create different kinds of friendships with those people.
Normal hours is 8 to 4, which is good. You have more time to spend outdoors.
You're only 3 hours from Adelaide if you want to go down for a trip.
It's definitely easier to access beautiful hikes, beautiful camping spots on the weekend.
The people out here are a lot more invested in us becoming well-functioning rural practitioners. So I do think we're supported well by the medical education department, but also the nursing staff and allied health.
I would highly recommend junior doctors to come experience rural because the training here is very good.
It's a brilliant place to learn, a brilliant place to do your internship. You'll be amazed by how much you learn, how much you upskill.
Experience-wise, it's probably one of the best things you can do. Even if you're planning on working in the city long term, it's always really handy to know what we do and we don't have out in rural areas.
For me, FUNLHN is a representation of what you can do. In terms of the future, for the junior doctors, the experience is about moulding them into being the type of doctor they want to be. It doesn't matter if they want to be general practitioners, rural generalists, anaesthetists, surgeons, we need them all. I also want them to understand the importance of rural medicine and coming back to service the community that is often not represented.